Hello and welcome. The COVID-19 virus continues to attack. It continues to grow. More than 7,500 cases in India now, and it's spreading in places like Mumbai, where I am. It's become an epicenter of sorts, and obviously the concern is growing. So there are many responses which are being worked on both in India and overseas, and we've been talking a lot about the work being done at the frontiers. With people from the medical profession, researchers, scientists, and so on. But let's also look at another aspect of controlling and containing this disease or the spread of it, which is using technology. So the government of India is and has launched something called Aarogya Setu. It's an app that sits on your smartphone if you download it, and then shares data about you via Bluetooth and GPS and to a central server, and which in turn allows you to know if there is someone who's COVID affected near you, and I'm assuming vice versa as well. So an app like this is very useful, and most people would welcome it at a time like this. But it also raises questions about the way the data is being gathered, collected, stored, and what happens in the longer term. So that's the question that we are really asking today, even as we try and understand both the front end and the back end of this fairly interesting and impressively put together application in a reasonably short period of time. My guests to do that are Lalitesh Katragadda. He's the founder of Indihood and an iSPIRT fellow. iSPIRT is an organization of IT tech companies. And he has worked on this app and contributed his valuable time and effort. I'm also joined by Raman Jit Chima, a senior international counsel at nonprofit Access Now, also co-founder of Internet Freedom Foundation, and a former India policy head, policy lead at Google. And Lalitesh is also Google X, so I don't know if you both work together at the same time, but you're definitely... But you're definitely from, you've all come from the same place. Okay, wonderful. So Lalitesh, let me begin with you very quickly. Now, tell us about this app and how does it work? And how was it designed? I know you're a maps expert. You've done a lot of work in mapping and building the mapping architecture at Google. So that's your specialization. And obviously, some of that has found its way into this app as well. So go ahead.
Yeah, so the app is actually, very straightforward. It's not a very sophisticated app. There is a level of sophistication that will develop over time. But what the app does is it does three things. One is it allows people to register themselves and answer questions when they choose to about how they are feeling and whether they have been in touch with somebody who was infected, known to them, or they have traveled internationally, using which we take this very complicated chart that ICMR has created about assessing people and assessing yourself, whether you are at risk or not. And using a few very simple chat-like questions, it determines that and tells you immediately whether you're fine, you are not well and need to take some care, or you are at risk and need to take some precautions, or you are at a high degree of risk and need to get tested immediately. Right?
Okay.
That is one thing it does. And the other thing it does in the background, as soon as you register, is it starts tracking two pieces of information. Mm-hmm. One of them is that whoever you come in touch with, who is also using a Aarogya Setu app, it looks at Bluetooth interaction. Mm-hmm. Basically listens to the other person's Bluetooth, and the other app listens to your Bluetooth. Now, both of you don't know who you are, and there is a de-identified ID which is behind this, so that the actual user information is not shared. And the other thing the app also measures is every 30 minutes, it measures your latitude, longitude, and both of them are kept on the phone. The only information that is then going to the server is whenever you take a self-assessment. Specifically when the self-assessment is showing that you are either unwell or at risk, that information goes to the server along with the latitude, longitude of where you took that test, so that if testing is required or some intervention is required, the authorities potentially know where you are. Right? Those are the two things that are happening, and the use of what is the use of all this? The use of all this, and we will talk about the algorithm separately. The use of all this is like you mentioned, if it so happens that one of the persons you came across and spent significant time and interaction with, where you're close enough to them and you spent a bunch of time with them, both of them matter. It will then, assess that you might be at risk and allow you to much earlier than any, PCR test might show otherwise. Much earlier, it will allow you to, either quarantine yourself, keep your family safe, or, you were close enough to that person that you need to get tested and advise you to test, and the health authorities will consequently help you get tested much earlier. And as you have been, if you've been like me, been up late nights and reading research papers about this infection.
Yeah.
There are two things which are, I think, material to this, what we are discussing. It's all about the biology. One is that this is contagious when you're asymptomatic. And a lot of the people who are infected never become symptomatic. But they're still contagious, right? And that is one. And the other one is that when you get symptomatic or when you get infected, the sooner you get treatment, the better. Because when the inversion happens and you have this seizure of the lungs, some people are calling it a cytokine storm, some people are calling it a hemoglobin reaction. We still don't know what the biology of this is yet, because this is moving so fast, right? But whatever the reason is, the sooner you get the treatment, the better off you are, more likely you are to recover, and so on, right? So this is all a race against time, and the whole idea of the app is not that you will immediately see benefits when you install. The idea is that if a large number of people install and we all use it, for the next 15, 30, 40 days, however long this crisis takes to peak, right? The peaking of this will happen in the next 4 to 6 weeks. We don't know when. Dr. Devi Shetty is saying this will peak towards end of April or middle of May. I'm inclined to believe a medical expert, right? Whenever it peaks, this will allow us to then, control and trace people and, quarantine people early and contain it much faster than we would otherwise. So that's what it is doing both from a back-end point of view and a front-end point of view.
Right. So, as a architecture, was there a specific intent to combine the medical part with the geolocation and the location part? Because somehow in earlier I thought that this was more about knowing whether there's an infected person around you or in your vicinity. But this is as much about following and trying to track the disease, which is slightly more complex phenomenon than just knowing where someone is.
Yeah, there are 3 parts. Let me first answer your last observation first. The moment somebody has a disease, right, unless they're taking their phone and running away out of quarantine or something, they're not going to be in the field. So detecting that somebody is near you who has a disease is unlikely, right? What is more likely is that you came in contact with that person before they were discovered they had a disease, right? And that is the reason we are doing the Bluetooth tracking, right? Now, the question is, why are we doing GPS? The reason why we are doing GPS is if we have sufficient data from multiple people who were later diagnosed to have a disease and they were the disease and they were all using the Aarogya Setu app, it allows us to very rapidly identify hotspots, right? Whether this infection happened in a coffee store or a coffee shop or near a kirana store or some other place where people were working, it will become evident much more rapidly, within hours of the disease being detected in those people, rather than days of trace work that health authorities and surveillance officers are doing right now, which at some point we have the capacity to do it today when we have a few thousand infected, but the capacity will disappear when if God forbid, if something like what is happening in New York or if it happens, it doesn't happen, but if it does happen, we won't have the state capacity to figure out where all this is coming from, and at that point it will be chaos. We are trying to contain that and solve the problem by reducing the effort levels to track this, which is why the GPS location.
Okay, Raman, so let me come to you very quickly now. So what are your first thoughts on this app, its applicability, and the way it's being positioned and then rolled out?
Thanks, Govindraj. I think the important thing to recognize is during this particular crisis, I think everyone's been trying to do this whole of society response, right? So whether you're a technologist, whether you're local government, whether you're state government, whether you're federal governments, you're trying to take urgent action. I think the one reality in this space about this larger response to this, including the sort of tech interventions, is we sometimes need to be a little bit cautious about what's effective. And sometimes the adage that works in the tech space, right, which is to move fast, break things, and like maybe patch them later, launch and iterate, can sometimes be more problematic when it comes to the public health space. More specifically, there are a couple of different things here. Remember that we have had contact tracing apps very specifically. That's what the Singapore example was, the Trace Together app, which a couple of days earlier this week has also been completely open sourced, and you can review and see the code base, but for a very specific purpose of allowing users to know if they have people nearby have self-declared themselves as being infected and being cautious about that. We already have learnings that there's been a small percentage of Singapore's population that use that app. In India's case, what we're doing right now is something which is somewhat unprecedented, is perhaps more equivalent to some of the Chinese, the People's Republic of China's interventions in terms of COVID tracing, where it is identification from mobile devices, it is sharing that in a central backend, it is also collecting location data and not using it just for a user to know what's happening, but for the government to potentially do, or rather public health authorities to look at potential hotspot tracking or location tracking. And there's already much more data than we're collecting perhaps than in many other places. And why I'm cautious about this is that, one, it does have implications. For example, even currently, it's not just about the data stored on your phone. It is the data that is stored centrally at the government's end, whether that's the Niti Aayog or some other agency. That's a good question to also ask.
I think the National Informatics Center, yeah.
Yeah, and who's keeping that? Who has access to that? NIC might be hosting it later. Right now, it's hosted on AWS, Amazon Web Services, and they're saying about porting it to NIC later. But who is actually in control of that? What is being kept there? And right now, for example, there's no clarity on what data is kept after the pandemic finishes. But let's just talk about during the pandemic time itself, right? There's been a lot of useful previous examples from, for example, tackling Ebola in Africa, where data-driven approach of using, say, call data records, massive geolocation of cell phones, where in fact the postscript, the after-action analysis as such, was that it was not very helpful. In fact, it may have been counterproductive and may have made things more confused. And therefore, we need to be cautious here. Contact tracing is an experimental step in terms of the app-based model. It's being tried for the first time. I would sometimes think it's worthwhile to look at what public health people are saying. And one of those facts, which is what Lalitesh himself said, is that this is only effective if nearly 50% or more of India's total population base uses this.
Yeah.
So one has to see how that happens. And if that sort of urgent step is being taken where basically a majority of our population is being asked to install this, we need to be very cautious about what's being there. Could it leak data in other ways? Could it be subject to malware? What happens to the data afterwards? But more importantly, even today, there's been talk that it will let you know about your possibility of being, say, infected. Is that a human-based intervention coming from the ICMR and state health agencies? Is that an algorithm right now coded between the Niti Aayog, NIC, and volunteers? So these are important questions there. Essentially, what I'm saying is, independent of just this app, we need to be a little bit cautious of tech solutionism when it comes to public health. It can be a useful assistant. I'm still not sure that it can do all these sorts of different things that we plan to do. And more troublingly, in India's case, we're perhaps trying to do a lot in one single app or one single dashboard. And that makes me generally wary.
Okay, Lalitesh, so are we trying to do too much in one app?
Well, we are trying to do whatever is necessary. Too much or not, I think time will tell whether it is. I think the more important thing that I'm focused on is this going to be effective? That I completely agree with Raman, is digital for the sake of digital is pointless unless you actually make it effective. And see, there are a few checks and balances that are there in the system. One is the information that we are storing on the phone, right, is only pulled down when it is determined that you are infected using a virology test, right? And in rare cases, it's determined that you're at very high risk because of deep proximity, right? And that is a color that you already have, or you have reported that you've been in deep proximity with somebody. So that percentage is, if you take the entire population of people who are registered, let's suppose tomorrow we have 400, 500 million people registered. And we currently have 6,000, even if that number goes to 100,000 and their cohorts, currently we are seeing a cohort ratio about 3 to 4. So then at that point, we will have 500,000 records downloaded to the server. The rest of them will remain on the phone. We are not downloading everybody's information, and we cannot, because you don't know this, but the team inside, the volunteer team has been, going at it day in and day out, battling it out, figuring out what is the privacy edge we can walk and what we cannot walk, right? I think we have spent more than 40% of our effort battling privacy and less writing the code and the app, because if we downloaded all the data to the server and ran this, we would be able to do a much easier job. The algorithm is very, very complex because we are minimizing the amount of data we are downloading. And
Okay.
and the other thing is, to Raman's point, I'm old enough to have made a lot of mistakes in data science, right? If you write enough algorithms, you will realize that most of your algorithms don't work the first time, right? So none of this is rolled out. So we have written the algorithms, but we have not rolled them out. And as in data comes in, currently the data is quite anemic, honestly. As and when the data comes in, if we have our algorithms have confidence in the data, even before informing the users. One of the reasons we have not taken the Singapore approach, one of the reasons we are very leery of the Apple and Google approach, is because it directly informs the user and tells them they're at risk, right? I think, and especially in a country like India, that can cause mass panic, right? So we are not doing that. We are detecting that, look, there is a potential set of people who might be in proximity. We are going to run that information by the health authorities. Possibly even, the first few days we get enough information, we will do on-ground testing to see if this algorithm is actually doing anything useful or not. If it's not doing anything useful, we'll discard the data, right? There's no value. The only value will then be people.
And what about longevity of this data? Do you feel, or rather, I mean, do you know, or do we know what's going to happen to this data, let's say July onwards or August onwards?
Yeah. So there are two constraints. One of the constraints is, I don't know if the latest terms of service has gone up on the web or not.
Yeah.
I apologize. The engineers are literally not sleeping, so I don't know where it is.
Sure.
But the latest privacy policy drafted by our legal counsel says four things. One is, it says that this data can only be used by the necessary health authorities and authorities delegated by them, potentially surveillance officers and so on, only for battling COVID-19, not even other infectious diseases, right? And there is no etc. for other purposes business, right? Because we did not want this to become a runaway train. And the other three constraints are, if you are never shown to be at risk, either through your self-assessment or through coming in close contact, we throw the data away on a running basis in 30 days. Even on your phone, it's wiped out within 30 days. If you are determined to be at risk, that window is expanded to 45 days. If you are virologically proved to be infected, where the virology test says that you're infected, after you're cured, we keep the data for 60 days for post-analysis, because the analysis of the data is very useful. And then all the non-anonymized data is thrown away. And to make sure that we are talking about anonymization and not like shallow anonymization, because anonymized data can be de-anonymized, right?
Yeah.
What we are doing is we are actually mixing up data of multiple people, usually in the space of 50 to 100 people, and bucketing it in large geofences, like 100 to 200 meter grids in dense urban areas, and even larger grids in rural areas. So there's at least data of 50 to 100 people in each of these buckets, and then anonymizing it, and then using that, keeping that for research, and the rest of it, the data is getting wiped out.
So you're saying, my sort of one key takeaway from what you've said, Lalitesh, is that the data is not going to be there in perpetuity on this database, or by extension with the government. So it's either a 30, 45 or 60-day window, but let's say latest 60 days or 90 days, after which the data is gone.
Yeah, and Govindraj, there is one more thing. I think this nuance is being lost. Most of the data never makes it to the government.
Right. So you said there's only the fringe which actually makes it. The rest of it sits on your this thing. What's another app that you could compare it with, Lalitesh, to so people understand what this is like?
Raman might know, but I'm trying to recall what other app, because where
the data is, let's say, primarily sitting on the phone. There's only exchange happening with the server.
Most of the apps I know, like Google Maps, Facebook, and so on, all the data flows to the server side. I don't know of many apps which of this scale where the data sits mostly on the client side. Okay,
Raman. So 2 points. One is Lalitesh's assertion that this is most of the data is going to be sitting on your phone and not getting transferred to the server. And the second, and what I think sounds more important, is that there is a window or a sunset for all this data, and at the end of which it all disappears. How do you see it?
See, the point to, of course, remember is that's based on the current design, which is why some of the more boring questions that lawyers and governance people tend to ask when it comes to government is, for example, who's running this, who's accountable for it, and how does it work? Because the reality, of course, with government, right, or with, say, the chief executive in a company, is they can set their own rules unless they're controlled by something else. In that case, say the board in the case of a company, or in the case of government, statute by parliament or something else there. But why I mention this is that that's an important point, because there's already been tension, right, as you've seen, between state governments and the center, even within central agencies sometimes about the powers, what's happening. Is this the National Disaster Management Authority in charge of this? Is it NITI Aayog? Is it NIC? Is it governed under the Epidemic Diseases Act or the National Disaster Management Authority Act? These are important things which I would say less so than the engineers who might be working around the clock. Government needs to answer. That's one. The second other important question is some of the data that's being collected. And again, I put that caveat. I'm a lawyer who spent a lot of time with product engineers and others. But I note that when you're trying to still collect large amounts of location data for predictive or later trend tracking, that's something that I would be cautious about. Because what you are doing, that is not something you want to keep immediately right afterwards. You want to potentially use for other things. Even the Singapore Trace Together app has had that criticism, where people have said it's been very clear that the app will not continue after the pandemic, that you can make a data deletion request, which, for example, with Aarogya Setu right now is not fully clear whether you can do so. And even in the case of the Singapore app, you can make that data deletion request. There have been points where even Singaporeans have raised concerns saying, well, what if the government still puts a retention order on it? How do I challenge it? Just imagine they're trying to do everything genuinely, but some officer for some reason decides to messes up or maliciously does it. How do you escalate that? That's the concern. But also what Lalitesh just said, right? That, he found, as he mentioned, it's hard to find a parallel about what's going on here, the amount of data collection that's happening, what's being shared, what's not. That is where, as a lawyer who deals with product people, I would sometimes be cautious. And that's where you say you need to have an open conversation. You need to ask other people to have sometimes open review and understand what the processes are. Because more importantly, if something goes wrong with this, my worry is not necessarily even the civil liberties consequence, but the public trust consequence. In a large, diverse country like ours, if something goes wrong with this, you will see so much skepticism and worry from the general population across different states, or working with the state government or working with the ICMR. That is something we must be very wary about. And that's the biggest concern here, that if something goes wrong, it might make the situation worse. And therefore, one has to be a little bit more careful and perhaps consult more. And more importantly, as I'll just draw, there is a global sense that governments are slightly jumping ahead too much and focusing on these app-based solutions, and perhaps not focusing on other elements or other key public health interventions. But of course, these are initial comments. I would just say that one means that right now we can perhaps open up this process a bit more, get some of these questions answered, not just by the engineers, but by the government itself. And maybe that's a first step that needs to be taken.
Right. So, Raman, I see it. I mean, I think you're essentially saying that, or if I've understood you correctly, you're okay with the concept, you're okay with what seems to be the execution at this point. But as long as the process going forward is made sufficiently open and there are opportunities for people like you to jump in and ask these questions and get them answered.
I'd come in just to... I was going to say that I think the reality is there's so much going on in this app, I can't necessarily say whether it's something I would immediately support, because it's not just contact tracing. It is predictive, it is health information being added and other steps there. That's one element. Secondly, just noting that if it requires nearly 50% of the population to use it, and therefore requires a lot of government resource and political energy to get everyone behind it, I would question if that is the most important thing to do right now, when we are having other data concerns with the government itself, for example, right, on release of COVID data and whether that's accurate there. So my take would be, the app has concerns from a public policy perspective. Is this what you want to double down on right now? I would be wary, and I would note there are other alternate approaches as well. And an engineer will come and say, look, there are 100 different ways you can build something, which is why sometimes I'll say, okay, therefore maybe you need to be sure that this is what you want to build, because that's going to take time and energy on behalf of the government, which at this point of time is perhaps the most precious commodity of them all.
Right. Okay. So, but Raman, it's possible that a government could work on many fronts, right? I mean, what Lalitesh is doing here is in some ways independent. He, in any case, is independent of the government and represents a bunch of interested people who are committed to do something and giving their time and effort. And that ends there. And then it's for other people to take over and say, now, is the right legal, technical architecture being created so as to protect citizens' rights and to ring fence it from leaking out or being misused in any way.
But that's exactly the concern I'd also had, Govindraj. So as you know, with any product, when you create it, it's about continuously running, right? It's not necessarily the initial engineering, creation, deployment, from the production network to the general, consumer usage. It is this constant maintenance. For example, even today, the shift from AWS to NIC that's being considered about. And that's one reason why I'd be concerned about who is really investing in it. How is that happening? How are people not just accountable, right? But how do we actually know who pulls that sometimes legal consequence, right? That this person's data must be kept in the system because it's very clearly they are infected. We need to issue an order under the Epidemic Diseases Act, which, by the way, only states can do to, for example, look at a particular person. That's the concern that is there. And we have seen the consequences sometimes of this build something and other people will come and run it approach, which is what I would say, just we should learn from history. And more importantly, I was struck by the fact that many people who've looked at the use of data solutions for the Ebola crisis and others have all said, we are very cautious about investing resources into things like this more generally. In the case of the Singapore app, its use case is very clear, right? It's ultimately basically for the populace to be able to know what's going on. As Lalitesh mentioned, the app says it's not appropriate for India. It might lead to panic. But that case is very clear. In the case of other apps, such as in China and elsewhere, as you know, they try to do many things. And of course, the difference between us and China is that ultimately we are a bit limited in what we can do in a democracy. And we do worry about the long-term consequences of what we can do. We must respond to a pandemic, but what continues afterwards should not be a violation of our basic idea of a democracy.
Right. Okay. So we are running out of time. So, and I mean, there will be some sort of evolving questions, which I'm sure I can come back to you both. So, Lalitesh, can I give you the last word to respond on these 2 points? One is, who owns the data today and likely tomorrow? And on the point of data deletion, and how do I as a citizen ensure that once things are okay or I'm better, that I want to get out of that system in a way that I understand it across this country and it's easy to do?
Yeah, so I think the data deletion policies are very clear, right? If you uninstall the app, the data is gone.
Okay.
Right? Because the data is sitting on your client. And the other point that is being raised is a little bit slightly untrue, that this app is useful only if 50% of the population installs. This app is immediately useful to you the day you install it, because you can report your own symptoms and get help, number one. This app is useful for figuring out where the hotspots in the city might be, completely anonymized, even if 10% of the people install, because that is what it takes statistically to understand where people might be, or locations where infection might be spreading. For contact tracing, yes, you need to get to 40-50%. I fully agree. But contact tracing, again, is sitting on your client, and the data is as safe as your phone is with you. So, and having said that, yes, there is a fear of Big Brother, and there is a fear of the government changing things later. And I think that is a question that I am not qualified to answer. Which is you can trust the government. But to answer one specific question, this data is currently under the control of NIC, and even though the servers are not in NIC, the data is being controlled entirely by NIC. This is a mighty app, right?
Okay, and it will. So this app reports to someone. So is that the Ministry of Health or to whom?
Yeah. So the stakeholders are the Ministry of Health.
Okay.
And all of these are the stakeholders we are corresponding with. But the entity responsible for maintaining and making sure the app works as it is supposed to is NIC, inside MIT.
Got it. Okay, wonderful. So we've run out of time. Thank you both for sharing your thoughts. This is an important step, and it is a step that needs to be watched carefully, perhaps encouraged, perhaps also questioned simultaneously at the same time, to ensure that our safeguards are protected. I mean, there are safeguards, and our interests and our privacy is protected, even as we as citizens feel safer at a time which is so unusual that not just here in India, but globally, people are facing a pandemic of size and condition that never has been seen before. We'll be back very soon. Thank you very much for joining us.
Thank you.
Thank you, Govindraj.